10 dangerous masturbation mistakes after 60 are silently destroying older men's health, yet almost no one discusses them. What worked in your 30s could now be damaging your prostate, weakening erections, and draining energy in ways you don't realize. I'm Dr. Grace Miller, a urologist with 25 years treating aging men's health. The first mistake is the most common and potentially devastating. The first dangerous mistake I see repeatedly in my practice is forcing erections when your body's blood flow has naturally declined. This happens when men try to achieve the same level of hardness they had decades earlier, using excessive pressure, aggressive stimulation, or prolonged manipulation to compensate for weaker erections. Many men come to me frustrated because what once happened effortlessly now requires intense effort. They describe gripping harder, stimulating longer, and pushing their bodies to respond the way they did at 30 or 40. What they don't realize is that after 60, your cardiovascular system undergoes significant changes. Blood vessels become less elastic, circulation decreases, and the delicate network of arteries that supply the penis simply can't deliver the same robust blood flow as before. When you force stimulation despite these natural changes, you're essentially asking damaged tissue to perform beyond its capacity. The repeated trauma from excessive pressure creates micro-tears in penile tissue. Over time, this can lead to scarring, further reduced sensitivity, and even more difficulty achieving natural erections. You're not solving the problem, you're making it worse. The physical consequences extend beyond just weaker erections. Forced stimulation can cause chronic inflammation, nerve damage, and in severe cases, permanent scarring that makes future erections even more challenging. Some men develop a condition called Peyronie's disease, where scar tissue causes painful, curved erections. Emotionally, this mistake creates a vicious cycle. The harder you push, the more frustrated you become when your body doesn't respond. This leads to performance anxiety, loss of confidence, and often complete avoidance of sexual activity. You start viewing your body as broken rather than simply changed. The solution requires a fundamental shift in approach. Instead of forcing your body to match your memories, learn to work with your current reality. Focus on gentle, patient stimulation that honors your body's new rhythm. Accept that erections may be less firm, but can still provide pleasure and satisfaction. Concentrate on sensation rather than hardness, and give yourself permission to take more time. Physical force isn't the only mistake that can harm you. Timing becomes equally critical, and the second dangerous error involves completely ignoring your body's new recovery timeline. Here's something that might surprise you. The frequency that felt perfectly normal in your 40s could be quietly destroying your health after 60. The second dangerous mistake is maintaining the same masturbation schedule without recognizing that your body now requires significantly more recovery time between sessions. I frequently encounter men who continue daily or even multiple daily sessions, believing this routine keeps them sexually healthy or helps manage stress. They wonder why they feel constantly drained, irritable, or emotionally flat, never connecting these symptoms to their unchanged sexual habits. What these men don't understand is that their hormonal and nervous systems have fundamentally shifted. Research shows that testosterone recovery after ejaculation takes considerably longer as men age. Where a 30-year-old might bounce back hormonally within hours, men over 60 often need several days to fully restore their biochemical balance. Your nervous system also requires more time to reset after the intense stimulation and release of orgasm. Continuing the same frequency that once energized you now systematically depletes your reserves. The physical toll accumulates silently but relentlessly. Chronic fatigue becomes your new normal as your body struggles to keep up with demands it can no longer meet. Your testosterone levels remain suppressed, unable to recover between sessions. Sleep patterns become disrupted as your nervous system stays in a state of overstimulation. You might notice decreased muscle mass, reduced motivation for physical activity, and a general sense of weakness that you attribute to normal aging. Emotionally, the impact can be devastating. Depleted hormones directly affect mood regulation, leading to increased irritability, anxiety, and depression. You may find yourself snapping at loved ones or feeling overwhelmed by situations that once seemed manageable. The loss of energy translates into decreased motivation for hobbies, social activities, and life goals. Many men describe feeling like they're just going through the motions of life rather than actively engaging with it. The solution requires honest assessment of your current energy levels and recovery patterns. Start by spacing your sessions further apart, perhaps every 3 to 4 days initially, and monitor how you feel. Pay attention to your energy, mood, and sleep quality in the days following masturbation. Your body will tell you its optimal rhythm if you listen. Some men find that reducing frequency to once or twice weekly dramatically improves their overall vitality and emotional stability. But frequency isn't the only timing issue that matters. The pace at which you approach self-pleasure has equally serious implications for your long-term sexual health. When did masturbation become a race against time? The third critical mistake I observe is treating self-pleasure like a mechanical task to complete quickly rather than an experience to savor. This rushed, goal-oriented approach that focuses solely on reaching climax as fast as possible is particularly damaging for men over 60. A common pattern emerges in my consultations. Men describe their masturbation as hurried, almost anxious experiences. They rush through the process, sometimes finishing within minutes, treating it more like a biological function than an opportunity for pleasure and connection with their own bodies. This mechanical approach often develops from decades of habit, privacy concerns, or simply viewing sexual release as something to accomplish rather than enjoy. The aging male body requires a fundamentally different approach to arousal than it did in younger years. Your nervous system processes stimulation more slowly, blood flow takes longer to build, and the entire sexual response cycle operates at a more deliberate pace. When you rush through masturbation, you're working against these natural changes rather than with them. Your body needs time to warm up, to build arousal gradually, and to fully experience the range of sensations available to you. Physically, rushing through self-pleasure leads to diminished sensitivity over time. When you consistently prioritize speed over sensation, your nerve endings become less responsive to subtle touch. The pleasure you experience becomes increasingly shallow, requiring more intense stimulation to achieve the same level of satisfaction. You miss the nuanced physical sensations that can make masturbation deeply fulfilling, training your body to respond only to aggressive, rapid stimulation. The emotional consequences run even deeper. Rushed masturbation disconnects you from your body and your capacity for intimacy, even intimacy with yourself. Many men report feeling emotionally numb or empty after quick mechanical sessions. This approach reinforces feelings of loneliness and disconnection, particularly for those who have lost partners or find themselves socially isolated. You're missing an opportunity for self-connection and emotional nourishment that could significantly improve your overall well-being. Learning to slow down transforms masturbation from a task into a form of self-care. Begin by setting aside unhurried time when you won't feel pressured to finish quickly. Focus on the journey rather than the destination, exploring different types of touch and paying attention to how your body responds. Allow arousal to build gradually, noticing the subtle changes in sensation and breathing. Practice mindfulness during the experience, staying present with what you're feeling rather than rushing toward orgasm. Speed isn't the only problematic approach that can harm your sexual health. Your physical environment and the positions you choose during masturbation have equally serious implications for your prostate and overall comfort. Most men never consider how their masturbation position might be slowly damaging one of their most vulnerable organs. The fourth dangerous mistake involves using positions that place sustained pressure on your prostate gland. a walnut-sized organ that becomes increasingly sensitive and prone to inflammation as you age. Statistical evidence from urological studies reveals a troubling connection between certain masturbation positions and chronic prostate issues in older men. The most problematic positions include sitting hunched forward, lying face down with weight on the pelvis, or any position that compresses the perineum, the area between your testicles and anus. These positions seem comfortable and natural, but they create sustained pressure on your prostate during the extended stimulation and muscular contractions of orgasm. After age 60, your prostate undergoes significant changes. The gland naturally enlarges, becomes more vascularized, and develops increased sensitivity to pressure and inflammation. What medical research clearly demonstrates is that repeated compression during sexual activity can trigger inflammatory responses that persist long after the session ends. The prostate's location, nestled deep within the pelvis and surrounded by sensitive nerve networks, makes it particularly vulnerable to positional pressure. The physical consequences develop gradually but can become debilitating. Chronic prostatitis creates a persistent ache in your pelvis, lower back, or groin that interferes with daily activities. Urinary problems emerge as the inflamed prostate presses against your urethra, causing weak stream, frequent urination, or the frustrating sensation of incomplete bladder emptying. You might experience burning during urination, or notice that you need to urinate more frequently during the night, disrupting your sleep and leaving you exhausted. These physical symptoms create a cascade of emotional challenges. Constant bathroom anxiety affects your confidence in social situations and travel plans. Interrupted sleep leads to irritability and depression. The persistent discomfort makes you reluctant to engage in physical activities or intimacy with partners. Many men begin withdrawing from social activities, avoiding situations where bathroom access might be limited, and feeling increasingly isolated by their symptoms. Protecting your prostate requires conscious attention to positioning during masturbation. Choose positions that keep weight off your pelvis, standing, lying on your back, or sitting upright with proper support. Avoid prolonged pressure on your perineum and take breaks during longer sessions to relieve any accumulated pressure. Always urinate after climax to flush your urethra and reduce the risk of bacterial buildup. Pay attention to any discomfort during or after masturbation, as your body's signals are crucial early warning signs. Physical positioning is crucial for protecting your prostate, but what you're watching during masturbation can be equally harmful to your long-term sexual and emotional health. The fifth mistake represents a silent epidemic among older men that's rewiring their brains in devastating ways, becoming completely dependent on high-intensity pornography for sexual arousal. This dependency doesn't happen overnight, but builds gradually as men chase increasingly extreme content to achieve the same level of stimulation their aging nervous systems once found in milder material. Research from neuroscience laboratories reveals why this dependency becomes particularly problematic after 60. The aging brain experiences natural changes in dopamine processing and neuroplasticity. When exposed repeatedly to the hyperstimulating visual and auditory bombardment of extreme pornography, these already compromised neural pathways become overwhelmed. The brain adapts by raising its threshold for arousal, requiring progressively more intense stimulation to trigger the same dopamine response that once came easily. This neurological adaptation creates a dangerous cycle. Men report needing increasingly graphic, violent, or unusual content to achieve arousal. What once excited them now seems bland and ineffective. They spend more time searching for content that can break through their elevated arousal threshold, often discovering they've crossed boundaries they never imagined they would. The material that once repulsed them becomes necessary for sexual function. The physical consequences extend far beyond the brain. Chronic overstimulation leads to what researchers call pornography-induced erectile dysfunction. Your body becomes unable to respond to real-world sexual stimuli, the gentle touch of a partner, the subtle excitement of anticipation, or even your own imagination. Many men discover they cannot achieve or maintain erections without the intense visual stimulation they've become dependent upon. This creates a devastating barrier to real intimacy and authentic sexual connection. Emotionally, this dependency creates profound shame and isolation. Men describe feeling like prisoners of their own sexual needs, ashamed of the content required for arousal, and terrified that others might discover their habits. The gap between their authentic selves and their sexual behavior becomes a source of deep internal conflict. For those seeking new relationships or trying to maintain existing ones, the inability to respond to real partners creates feelings of inadequacy and deception. Recovery requires a gradual but determined approach. Begin by reducing your consumption of extreme content, replacing it initially with milder material, then transitioning to imagination-based arousal. Practice mindfulness during masturbation, focusing on physical sensations rather than visual stimuli. Consider periods of complete abstinence from pornography to allow your brain's reward systems to reset. Rediscover your capacity for fantasy and mental arousal, skills that pornography dependency gradually erodes. What you watch affects your mind profoundly, but what you use on your body during masturbation can cause equally serious physical damage to your aging skin and sensitive tissues. Are you unknowingly creating microscopic wounds every time you masturbate? The sixth dangerous mistake involves using inappropriate lubricants, or more commonly, no lubrication at all on skin that has become dramatically more fragile and sensitive with age. Dermatological research shows that male genital skin undergoes significant changes after 60. The epidermis becomes thinner, collagen production decreases, and natural moisture retention diminishes substantially. Yet many men continue masturbating with the same dry techniques they used in their youth, or they choose lubricants based on convenience rather than compatibility with aging skin. Some use soap, lotion, or household products that contain harsh chemicals, fragrances, or alcohol that can severely irritate delicate tissue. The aging process fundamentally alters how your skin responds to friction and chemical exposure. What medical studies reveal is alarming. Dry masturbation on aging skin creates microscopic tears that are invisible to the naked eye, but provide entry points for bacteria and fungi. These microtraumas accumulate over time, leading to chronic low-grade inflammation that gradually reduces skin elasticity and nerve sensitivity. Even lubricants designed for younger skin can contain ingredients that older, more sensitive tissue cannot tolerate. The physical damage progresses insidiously. You might notice increased redness, irritation, or a burning sensation during or after masturbation. Small cuts or abrasions may appear, healing slowly due to reduced circulation and slower cell regeneration. Over months and years, repeated trauma leads to scarring, permanent discoloration, and significantly reduced sensitivity. Some men develop chronic dermatitis or recurring infections that require medical treatment and can interfere with all forms of sexual activity. The emotional toll of damaged genital skin extends far beyond physical discomfort. Visible irritation, scarring, or chronic inflammation creates deep shame and self-consciousness. Many men become reluctant to engage in any sexual activity, fearing that partners will notice or be repulsed by the appearance of their genitals. The constant discomfort serves as a reminder of their sexual activity, creating guilt and anxiety around what should be a natural, healthy behavior. Protecting your skin requires deliberate attention to lubrication and product selection. Choose lubricants specifically formulated for sensitive skin, avoiding anything with glycerin, parabens, or artificial fragrances. Water-based lubricants are generally gentler than oil-based options, and some men benefit from products specifically designed for postmenopausal women, which address similar issues of tissue thinning and sensitivity. Apply lubrication generously and reapply as needed during longer sessions. After masturbation, gently clean the area with warm water and pat dry, avoiding harsh rubbing or chemical cleansers. Proper skincare is essential for maintaining sexual health, but even with perfect lubrication, your grip technique can cause equally serious damage to the delicate structures beneath the skin. The seventh mistake cuts to the heart of how dramatically your body has changed, maintaining the same firm grip pressure that once brought pleasure but now slowly destroys your nerve sensitivity. This seemingly minor technical detail represents one of the most overlooked yet devastating errors older men make during masturbation. Neurological studies tracking age-related changes in penile sensitivity reveal a startling pattern. The nerve pathways that transmit pleasure sensations undergo significant changes after 60, becoming both more fragile and paradoxically requiring more nuanced stimulation to function optimally. Yet I consistently observe men compensating for decreased sensation by gripping harder rather than adjusting their technique. They squeeze tighter, thinking more pressure will restore the intensity they remember, not realizing they're systematically damaging the very nerves they're trying to stimulate. The aging nervous system operates on fundamentally different principles than younger neural networks. Pressure that once enhanced sensation now overwhelms delicate nerve endings, causing them to shut down rather than respond. Sustained firm grip during masturbation compresses blood vessels that nourish these nerves, creating periods of oxygen deprivation that gradually kill nerve cells. The damage is cumulative and largely irreversible. Each session with excessive pressure reduces your future capacity for pleasure. Physical consequences manifest as progressive numbness and decreased responsiveness that many men mistake for normal aging. Areas that once provided intense pleasure become increasingly dull, requiring ever firmer grip to achieve any sensation at all. This creates a destructive cycle where reduced sensitivity demands increased pressure, which further damages nerves and reduces sensitivity. Eventually, many men find themselves unable to climax without grip pressure that would have been painful in their younger years. The emotional impact extends far beyond solo sessions. Men describe the heartbreak of being unable to climax with partners because their bodies have become conditioned to pressure levels that no human touch can provide. Relationships suffer as frustrated partners feel inadequate or rejected. The man himself experiences deep shame about his inability to respond to gentle, loving touch, often withdrawing from intimate contact entirely rather than confronting his changed needs. Retraining your touch requires patience and deliberate practice. Begin by consciously reducing grip pressure by approximately half of what feels natural. Focus on varied types of stimulation, different speeds, rhythms, and areas of contact rather than simply pressing harder. Practice with just fingertips rather than full hand gripping. Allow yourself to rediscover subtle sensations you may have forgotten existed. The goal is not immediate intense pleasure, but gradual restoration of your nerve sensitivity and expansion of your pleasure capacity. Physical technique matters enormously for preserving your sexual function, but the emotional and psychological context in which you masturbate can be equally destructive to your overall well-being in relationships. The eighth mistake transforms what should be a healthy expression of sexuality into a destructive emotional crutch, using masturbation as your primary method for managing difficult emotions like grief, loneliness, anxiety, or boredom. This pattern becomes particularly dangerous after 60, when life changes often intensify emotional challenges, and healthy coping mechanisms become more crucial than ever. Clinical observations from my practice reveal a troubling trend among older men who have experienced significant losses: death of spouses, retirement transitions, health diagnoses, or social isolation. Many report turning to masturbation whenever they feel overwhelmed by sadness, anger, or emptiness. What begins as occasional emotional relief gradually becomes their go-to response for any psychological discomfort. They masturbate not from genuine sexual desire, but as an escape from feelings they don't want to face. Psychology research demonstrates why this coping mechanism becomes particularly problematic with age. Emotional masturbation floods the brain with feel-good chemicals that temporarily mask psychological pain without addressing its underlying causes. For older men dealing with complex grief, health anxieties, or existential concerns about aging and mortality, This chemical escape prevents the natural processing of emotions necessary for psychological healing. The temporary relief becomes increasingly necessary as emotional tolerance decreases and unprocessed feelings accumulate. The physical toll of emotion-driven masturbation often exceeds what your aging body can handle. When you masturbate from emotional distress rather than genuine arousal, your body isn't prepared for sexual activity. Forced arousal when you're psychologically upset can strain your cardiovascular system, disrupt sleep patterns, and deplete energy reserves you need for genuine emotional healing. The frequency often increases as emotions intensify, leading to the physical exhaustion and hormonal depletion discussed in earlier chapters. Emotionally, this pattern creates devastating long-term consequences. Instead of developing healthy ways to process grief, loneliness, or anxiety, you become dependent on sexual release for emotional regulation. This dependency prevents you from seeking appropriate support, whether through counseling, social connections, or spiritual practices that could address root causes of your distress. Many men describe feeling emotionally numb except during sexual activity, having lost touch with their full range of feelings and healthy ways to experience comfort. Breaking this cycle requires developing alternative coping strategies before emotional crises overwhelm you. Practice identifying emotional triggers that lead to compulsive masturbation, specific times of day, anniversary dates, or particular feelings of loneliness. Create a toolkit of healthier responses, calling a friend, taking a walk, engaging in a hobby, or practicing meditation. Consider professional counseling to address underlying grief or depression that masturbation has been masking. Reserve sexual activity for times when you feel genuinely aroused rather than emotionally desperate. Your emotional health connects to physical timing in ways you might not expect, and the ninth mistake involves completely ignoring the warning signs your body sends when sexual activity is causing genuine harm. Your body speaks to you constantly, but the ninth dangerous mistake is choosing not to listen when it warns you that masturbation is causing genuine harm. This willful ignorance of physical warning signs represents one of the most preventable yet devastating errors older men make, often leading to irreversible damage that could have been avoided with early attention. The most concerning pattern I observe involves men who experience clear warning signals: pelvic pain, burning during urination, blood in semen, persistent soreness, or unusual discharge, yet continue their sexual habits unchanged. They rationalize these symptoms as normal aging, temporary inconveniences, or unrelated issues. Some fear that acknowledging sexual-related symptoms might lead to embarrassing medical conversations or recommendations to stop sexual activity entirely, so they simply ignore increasingly serious warning signs. Medical physiology shows us that pain and discomfort during or after sexual activity represent your body's emergency communication system. Unlike younger men whose bodies can often recover from minor sexual trauma without lasting consequences, the aging male body has reduced healing capacity, compromised immune function, and decreased circulation that makes early intervention crucial. Warning signs that might have resolved spontaneously at 30 can develop into chronic, debilitating conditions at 70 if ignored. The physical consequences of ignoring these warnings can be devastating and permanent. What begins as mild discomfort can progress to chronic prostatitis, urethral scarring, or serious infections that require aggressive medical treatment. Some men develop conditions that make all sexual activity painful or impossible. Others face surgical interventions or long-term medication regimens that could have been avoided with early recognition and simple behavioral modifications. The emotional toll of ignored warning signs often proves even more damaging than the physical consequences. Men describe living with constant anxiety about their symptoms, fear of serious underlying diseases, and deep regret about not seeking help sooner. The shame of having sexual-related medical problems often prevents them from getting proper treatment, even when symptoms become severe. This creates a cycle of worsening physical problems and increasing emotional distress that affects every aspect of their lives. Learning to listen to your body requires honest self-assessment and courage to seek help when needed. Pay attention to any pain, discomfort, unusual sensations, or changes in urination that occur during or after masturbation. Keep a simple journal, noting any symptoms and their relationship to sexual activity. Don't rationalize away warning signs or assume they'll resolve on their own. Schedule regular checkups with healthcare providers who are comfortable discussing sexual health, and be honest about your symptoms and concerns. Your body's warning signals are crucial for preventing serious problems, but equally important is what you do immediately after masturbation to protect your health and prevent complications. The 10th and final dangerous mistake might seem trivial, but it causes more preventable health complications than any other error: completely neglecting proper hygiene and self-care after masturbation. This oversight becomes particularly hazardous after 60, when your immune system's ability to fight off infections has significantly diminished. A disturbing trend emerges in emergency room data showing increased urinary tract infections, bacterial prostatitis, and genital infections among older men who could easily prevent these conditions with basic post-sexual hygiene. Many men finish masturbating and immediately return to other activities without cleaning themselves, urinating to flush their urethras, or monitoring for any unusual symptoms. They assume their bodies will handle any bacterial exposure the same way they did decades earlier, not realizing how dramatically their infection-fighting capacity has declined. Immunological research reveals why post-session care becomes critical with age. Your immune system's response time slows considerably, allowing bacteria that would have been quickly eliminated in younger years to establish infections. The pH balance of your genital area changes with age, creating environments more hospitable to harmful microorganisms. Circulation decreases, meaning your body's natural cleaning and healing mechanisms work less efficiently. What once required no conscious attention now demands deliberate preventive action. The physical consequences of poor post-session hygiene can be serious and recurring. Urinary tract infections become more frequent and harder to treat, sometimes progressing to kidney infections that require hospitalization. Bacterial prostatitis can develop into chronic conditions causing persistent pain and urinary problems. Skin infections around the genital area heal slowly and may leave permanent scarring or discoloration. Some men develop chronic inflammation that makes all sexual activity uncomfortable or painful. The emotional impact of preventable infections creates deep shame and anxiety. Men describe feeling embarrassed about having to explain recurring urinary problems to healthcare providers, especially when the infections are clearly related to sexual activity. Many delay seeking treatment, allowing conditions to worsen because they're mortified about the cause. The fear of judgment or awkward questions keeps them from getting help, creating cycles of worsening physical problems and increasing emotional distress. Protecting yourself requires establishing a simple but consistent post-masturbation routine. Always urinate within 30 minutes after climax to flush bacteria from your urethra. Gently clean your genital area with warm water, avoiding harsh soaps or chemicals that can irritate sensitive skin. Pat the area dry rather than rubbing vigorously. Check for any unusual redness, swelling, or irritation that might indicate developing problems. If you notice any concerning symptoms, seek medical attention promptly rather than hoping they'll resolve on their own. These 10 mistakes represent more than just individual errors. They form a pattern of disconnection from your changing body and its evolving needs. The man who forces erections despite declining blood flow, rushes through self-pleasure, ignores his prostate's vulnerability, depends on extreme pornography, neglects proper lubrication, maintains damaging grip pressure, uses sex to avoid emotions, ignores warning signs, and skips basic hygiene is not just making technical mistakes. He's refusing to acknowledge that his body has wisdom to offer, signals to share, and a new rhythm that deserves respect. Your sexuality after 60 doesn't have to be a source of damage, depletion, or shame. When approached with awareness, patience, and care, it can become a source of deep satisfaction, self-connection, and vitality that enhances, rather than undermines your overall health. The choice is yours. Continue the patterns that slowly harm you, or embrace an approach that honors both your experience and your body's current needs. Your future self will thank you for choosing wisdom over habit, care over convenience, and health over short-term gratification.